Thanks, Margot. Hey, Becky.
Hi, sorry I was late.
No worries. We had about 28 people registered, so I do expect a few more. As we said, with the APCA launch, we know that people are kind of stretching themselves between different things. Hey, Chris, thank you for joining.
Hey, thank you. I suspect some people might be trickling in a little bit. In the interest of time, do we want to start? And because we also know that some people have to step a little bit earlier. Caroline.
Yeah, great. Thanks, Florence. Yeah, so and thanks, Margot, for the slide. Yeah, so as Florence was just saying, we've got a couple of the people presenting today need to leave on the hour, so we're going to try and make sure we progress quite quickly through the agenda. And if we want to have if we run out of time for discussion on some of the points, we'll just keep discussion to the end for the people who are able to stay. So as you will hopefully have seen from the agenda that we shared in the on the platform, with the first agenda item is the conference on the Ministerial Conference on Violence Against Children. So we've got a couple of pieces under that. The first of all, the call to action on child protection system strengthening, which Save the Children and UNICEF have been leading on, and so Becky's going to speak a bit about that. And then also looking at the work that a group of us have been doing around the specific links between violence against children and children's care. And Florence is going to present on that. And then after that, we'll move on to Marie is going to present on some of the work that she's been doing around the Summit of the Future, which is coming up in the autumn. And then if we have time, we might have a really brief discussion on the consultations on care and support, though I think it will depend on who's here and who turns up for the rest of the meeting, because we know that Manny from Open Homes has been working on this, but he isn't able to join, so it might be quite a quick one at that point. So just to make sure oh yeah, and AOB as well. Thanks, Florence. We'll have that at the end. So just to make sure we stick to time, I'll pass over to Becky, if you're happy to introduce the child protection system strengthening piece. Thanks.
I don't know if you want me to, if I can share my screen. I don't know if that's possible. Let's see.
It should be. Okay, let us know if not.
Where is the, share screen. Okay, let me just pull up the slide. So basically, with this call to action on child protection system strengthening, where it came from is that we really we are concerned that I think there's been a lot more focus on individual issues, and especially with the ending of the Global Partnership to End Violence Against Children, we were thinking, how do we really promote child protection systems as a way to reduce violence and to also connect it to a lot of the issues that we work on? So whether or not it's child marriage or street-connected children or alternative care, we do need a strong child protection system to then, caseworkers that would connect to a national system to then respond. And we thought that this ministerial conference would be a very good way to bring that to the attention of government so that they can commit to child protection systems. But we have been calling for strengthening child protection systems for a very long time. So the other idea is like, how do we really put this back on the agenda of governments and think about what it is tangibly? Because I think there's so many components of a child protection system and it looks different. Different ministries are in charge of running it in different places. You have national action plans to end violence. You have national action plans to support women, et cetera. And how does this all come together? So we have come up with a one-pager, which I believe, we can share with you to really look at this. And let me, share screen. Just hold on a second. And I'll show you the main components of it. It is a one-page sort of communications document that we would like to get endorsement from civil society and governments to really sort of commit to and strengthening child protection systems. And if you look at some of the key areas that we have called for in this one pager, it's about committing to adopting and implementing laws and policies that protect all children from violence, abuse, exploitation, and neglect in all contexts. So we are thinking about humanitarian and development. Appointing a dedicated legal government agency to coordinate national actors at the national, subnational, and local levels. And we're trying to be like, that could look different in different countries, but we do want that coordination to work. We feel like that's where a lot of this is getting stuck. And then there's one really looking at the continuum of services, both at early intervention, prevention, early intervention, and response. We've added a point on alternative care, and I think Florence has also suggested really like committing to ending child institutionalization within this call to action, investing in a dedicated social service workforce. And what we would like is to commit to like accreditation processes, recognition of both the civil society role and the government in this social service workforce, looking at those that need to just identify and refer, and then those that are more professionals and the government role in that. Really thinking about communities and children in their own protection and how do we support those community-based interventions, and then enhancing government data systems. So taking away that individual, like using case management data in an anonymized way so that governments can really look at trends and target and budget more effectively. So this is what we would like to launch at the ministerial conference together with UNICEF, and we would like many organizations to sign up to this. We open it up for discussion, but we're really just looking for like major significant things that are missing, and we would like to connect it to the, if there's going to be a satellite event related to violence against children and alternative care, we think this would be important. We would like to get consensus on this quickly so that we can also try and inform where possible the national preparatory sessions in the run-up to the conference, because what we want is at the conference, they're going to have a ministerial panel on this, and we want governments committing to changes to what they are going to do in their own context to strengthen child protection systems, which we can then hold them accountable for. And we're hoping that this will also be part of pathfinding, when a country signs up to be a pathfinding country to end violence, that there will be a component of strengthening child protection systems to prevent and respond to violence against children. And I do think that there's connections, obviously, between violence against children and then alternative care as well, both preventing separation from happening and then also supporting children who can't stay with their biological family for whatever reason. So I just wanted to bring this to your attention. I would love for the members of Transforming Children's Care to endorse it. I would also really like to, think through how do we make sure that alternative care is highlighted, but also that it's a one-page document. So I'm happy to share that with you, what we're really looking for. So in the document, what we're really kind of thinking about is any areas that you feel are not targeted enough. Like we have been saying quite often, we've been calling for this for a long time. The more specific that we can get, the better. Any significant gaps, we're not wordsmithing, we're not adding everyone's individual issue on here, but if there are significant gaps that you feel are missing related to strengthening child protection systems, and also anything that would inhibit your agency from endorsing this call to action. So those are the things that we're looking for. I can share that with the group, and then we're taking 1 week to have kind of that top red line feedback. Then we'll send it out for endorsement once we've had some small tweaks. We just want to make sure that we don't send it out for endorsement and then have any changes. So we want to make sure we get small amounts of feedback. Now, again, not wordsmithing. I don't want your PhD on whatever. But I do really want your inputs. And to me, it's really important to connect the agenda on violence against children together with alternative care. And I'm sorry, I am going to have to leave on the hour, but I wanted to raise this initially. So I'm going to stop sharing and really open to your thoughts, comments, suggestions. Thanks. Hello, lovely to see your faces.
Does anyone have any initial
I
thoughts?
see Florence has made a comment in the
Oh yeah,
chat.
Florence, you've been in the chat. Do you want to say anything?
Yeah, this really links in very well. I'm just doing a consultancy for UNICEF in Czechia, who have been talking about reforming their system for decades, and we're going to try and get it moving. So I've been looking at exactly all of these things. And the one thing which I am missing in the list, which is fairly comprehensive, is the inclusion of the marginalized groups, so the indigenous groups, children with disabilities, because they are more than other groups also being subjected to violence because of their marginalization, both because they're institutionalized too much, but also because just the hate speech and the hate actions against them in public and in private. So I think that's very important to include.
No, that's really important. And one of the things that our colleagues in Latin and South America have also really highlighted is thinking about cross borders as well, like groups that are coming from one country to another, or claiming asylum or refugees. Migration and displacement really does inhibit you from possibly entering into a child protection system or getting access to the services and support you need. Great, good point. And yes, Chris, I will. Yeah. Okay. It's already part of the agenda. Yeah. But happy to email it to you directly as well. And then do send me your feedback by email. We're going to try and take on, the feedback as much as we can, but then I want this to be a transparent process. So anything that we can't fit in for whatever reason, or, length or whatever the comms colleagues think it's too wordy, I will let you know why as well.
And Becky, maybe just to clarify, the coalition behind this is spanning across humanitarian development.
Yeah. So we have sent this out to Transforming Children's Care Alliance, you guys, obviously, and also the CSO Forum to End Violence, which is now kind of reinvigorated at the moment around this ministerial conference, as well as the Alliance for Child Protection and Humanitarian Action and the Global Social Service Workforce Alliance. So we are trying to reach out to many different groups. And for endorsement, we do want to get coalitions as well, like the African Child Policy Forum and the SRSG VAC office as well. If you think there are other groups or organizations, we don't want 12 pages of logos, but we do want a wide variety of organizations that work on this issue. So if you have suggestions about who we should seek out endorsement from, please do let me know as well. And you can always email me. I'm happy to let you know more about it.
Great, thanks, Becky. Are there any more initial comments and thoughts? Or if not, we'll move on to the next agenda item. We can always come back to this. Oh, Margot, you
Amanda had a hand up.
Amanda, sorry, your hand up. Sorry.
Yeah, it's okay. I mean, I can email them to you anyway, but just a couple of things that flashed through my mind when I read it, and there may be very good reasons for why you haven't included. One is that as well as the social services workforce, I think it's the judiciary as well, because they're so crucial to making the decisions. So I think I'd incorporate those. And then it's also the other aspect that I feel is key, but you may feel it's covered by your second bullet point, is looking at the interconnection with other sectors, the sort of, the health and everything. So that those would be the two things that just struck me when I saw it. But there may be, as I say, there may be good reasons why they're not there.
No, we can definitely try and highlight that a little bit more, because I think we're also, with the World Health Organization leading this conference, I think we keep pushing, remember the Ministry of Social Affairs, but it's equally important for us to remember how influential education, health, and justice are, and other sectors too. And I think that's really important for the satellite events too, with Safe to Learn and Safe Online, and then, looking at parenting, like how they connect together. It just helps us to really think through, how do we coordinate across multiple sectors, and how could maybe the Ministry of Social Affairs help that coordination, but that could also be a coordination mechanism in a different way in a different country. There could be a lead under many different ministries, depending on how the organization is structured, and they all have a role. So yeah, let me look at how I can fit in a little bit more wording, especially health and judiciary. Thanks.
And then Becky, just to add, in addition to what you mentioned in a discussion yesterday, I also flagged the lack of reference to the importance of cross-border child protection coordination, bearing in mind we highlight migration, displacement, and so on. But this is going to be one of our biggest challenges as child protection system can strengthen, which our children are. Families are spread across borders, and our systems are not made to collaborate with one another. So.
Good point. Okay, written those points down as well.
Great, thanks. And just to flag to everyone that Becky's posted the document directly in the chat now, so if anyone wants to download that straight away. And comments are is it by the end of the week to you, Becky?
End of next week. So we're getting it out now. People are having discussions, and then end of next week. But really, red lines, please. If you want to be, really want us to consider it, I just can't have paragraphs of text. It just makes it much harder to really pull in those few things. We want to keep it to a page. We want it to be a high level and comsy. So, and the other thing is there, we went back and forth with UNICEF, really wanted to include their definition of child protection systems, and we ended up taking it out because we felt like it's more of a supplemental document. So are there other things where we could have more of an explanation about the elements of a child protection system, about how we coordinate? And then the other element is, what do we do after this conference? Like, how do we keep following up, and how do we better coordinate across civil society as well, and have similar messages to government in a country where we're working? I think that's something for us to consider going ahead, because we all come with our issue or our funded thing, and you're working in this province, I'm working in that province. Let's set up a different coordination mechanism, and then we don't actually kind of connect. So something to consider.
Great, thanks very much. In that case, I will pass over then to Florence to talk a little bit about the back and care group and some of the work streams that we have going on there. Thanks.
Yeah, thank you, Caroline. And maybe just to step back, because I know we're a small group today, there's a lot going on today, but some of you clearly are involved in this. But just to go back to this question of the global conference, it is, and we talked about it at the last meeting, it is the first global ministerial conference on ending violence against children. And its aim is to kind of reinvigorate the work that's been happening around violence against children globally, under the INSPIRE strategy, and with the pathfinding countries. And so it's a huge opportunity to ensure that the intersection between violence against children and children's care, and we know that entails both the fact that it's a driver of children going into alternative care and being separated, as well as it is a reality for children who are in alternative care in many ways, quite pervasively, as well as, of course, it continues to be an issue as children get reintegrated, and in fact, young people who come out of care when they transition into society and so on, also at high risk of violence. So the intersection we're all very familiar with. They are across that continuum. And we haven't been, as a community, we've done a lot of work around violence in care. Some of you will be familiar with some of the work, and have been involved in the work that happened before. There was regional expert consultation in 2016, 2015 in Latin America and Africa on this issue. There's been, of course, work around the UN General Assembly resolution in 2019 that includes this, the DGD. We've all been working on different aspects. But we've not been necessarily that great as a community at integrating our work as part of the efforts that are happening by actors working on the violence framework and on the implementation through INSPIRE. And so this is, at the same time, the violence actor, which some of us also are. So we wear multiple hats, some of us, but not all of us, haven't been as great either to recognize the group, the fact that this intersection between care and violence is so critical, is actually often missed from the violence agenda. So this is not a group of children that often get addressed, or young people that often gets addressed in the violence work. In fact, it often gets completely bypassed in terms of intervention, in terms of discussion, in terms of investment, and also participation of the actors. So this conference is a real opportunity for us to do better together. and to ensure that we're not just there to put the issue on the agenda, but we're there to be looking at it as a process that enable us both previous to the conference, past the conference, to integrate those efforts at national level, regional level, global level more effectively. So with that in mind, as we mentioned at the last meeting, we brought together, and we, in this case, I'm talking about Lumos and BCN, together with other actors, Becky and others, came together and said, okay, we need those who are interested in contributing to this. Let's get together and let's start thinking about what that would look like and so on. So we've got a working group on violence against children and care, which is looking at this process and at advocacy as part of it, but also beyond it. Again, you're very welcome to join this group. Most of you are already in that group, and others as well. Part of it has been looking at how do we bring this integration into it. So part of it has been, as Becky points out, the intersection between different aspects of what's on the agenda, like the child protection system strengthening. How do we bring in this question of, addressing violence in the context of care as part of that? And whether it's, there are a number of satellite events, there are national and regional preparatory meetings, and a range of webinars and opportunities. So how do we do that? So the kind of things that we're working on has been, first of all, the conference. One of the most important things that's happening, and some of you will be involved in that, are the national and regional preparatory meetings that are taking place. And basically governments, and I know I'm probably talking something you're very familiar with, but governments have been asked to make a commitment and to come to the conference with a pledge and have a national consultation about to agree on what that commitment will be, and so articulate that their own call to action, if you want, or their own commitment, and come to the conference having made that pledge, and then bringing that to the agenda of the conference. So there are a number. There's about 40, 45. We've got the list of countries that at this stage have said that they will organize a national preparatory session. Sometimes it's at the country level. There's some that are actually doing it at the municipal level as well. Others have said they're going to do it, but haven't really started. And the coalition of actors that are leading this conference, the SRSG on VAC, Becky mentioned, WHO, UNICEF, others that are organizing, number of governments. There's a group of countries that are called Friend of the Conference that are supporting its organization. Have provided guidance on what the national preparatory process should be. So all of this, we can, if you haven't got that, we can share that with you. Why it's very important is because in this national preparatory session, as government discuss across agencies, across department, what are those commitments nationally around violence against children that they need to make, it's really important that we bring this question of violence and care as part of that. So, we are not going to be able to be influential in the pledge and the declaration that's going to be adopted in Bogota if the government haven't really discussed this or seen this even as part of their agenda at the national level. So, we're talking to many actors, and you included, about how, what is happening at the national level in terms of national preparatory events, what's on the agenda, who's involved, making sure that both care experience actors are involved and at the table, that agencies working on care reforms, as well as family, as part of care reform, we're of course talking about family strengthening, prevention of separation, etc., that are at the table, making sure that disability actors are at the table, etc. Like to your point, Florence, absolutely critical that those that are often overrepresented within the care systems are at the table and influencing that agenda. So the national preparatory session, there's a few regional sessions that are being discussed, one at the European level, which I think is going to be a virtual one, if I'm not mistaken. There's also going to be this discussion about a virtual one in September for Africa. It's going to be a webinar rather than, I think, a full consultation, but it's going to be looking at the key issues that are coming around violence against children across the continent. So that's also an important opportunity. There is going to be a Latin American one that's going to take place actually just before the conference, and that has a strong focus around the health ministries in particular. Others, I should add, are bringing in different ministries, which is really the important thing, bringing the different ministries. Often it's the health ministry that's in charge of violence at the country level, but clearly without the agency in charge of child protection, of justice, of, you know, of all these different aspects, education and so on, then you can't really have an effective plan. So national, regional preparatory events are something to flag. And if you want to know, if you're not aware already, you probably are working on it. If you don't know where the countries you're involved in are involved in this, let us know, and we can share the information we have. Secondly, as I mentioned, there's a series of webinars. You may have attended some that are being organized under the Inspire banner, and on different themes under the Inspire strategy. And what we've done has been working with colleagues to make sure that the intersection between violence and care is highlighted in at least 2 of these webinars. So we're going to have the first one, well, the first one of those webinars that are where we have key actors presenting on this. Chris is involved, Charles I, David, the country director, is going to be presenting on the 31st of July on the session which is relating to safe environment, sorry. Was going to be presenting on the work that Charles I Foundation in Uganda has been doing on supporting the reintegration of children into families where there have been safeguarding issues, which is a critical aspect of that intersection as well. At the end of, I forget the date, but I think it's the September, Hagar, Cambodia, is going to be presenting on the work that they're doing in Cambodia around providing foster care for children who've experienced sexual abuse and trafficking. So again, showing that intersection where the care systems become actually critical for children, and how do we ensure that these intersections are being addressed. Those webinars, there are a whole series of them. I encourage you to find out about them. And they are really about the practice, so learning about the practice. Other things that we're doing, and Becky mentioned it, we have a satellite event on violence against children and care that is now confirmed. It's going to happen on the 6th of November in Bogota. It's going to be quite an in-depth session that is, we're delighted to say, going to be headed by the SRSG on violence against children, who's agreed to be a keynote speaker. The aim of the satellite event, we're going to have care experience actors, the director of the Colombian network, Latin American network. We're going to have a government champion as well, and a number of practitioners and country. We're still finalizing the agenda. So again, this is something that's on a discussion. If you're interested in contributing, please. Many of you already are. The aim of the satellite event is to really enable some kind of more deep dive conversation, putting it on the agenda, of course, of the conference, but again, going beyond the conference. What are these key intersections? What do we know? What have we learned? How do we do this better? And what are some of the examples where the work around strengthening care system is addressing violence, but also where the work on violence against children needs to address more effectively the violence that these children are facing. So there are, different aspects of that satellite event. Sorry, I jumped on one thing which is critical. We are going to be also, we're working on 2 documents. One, which Caroline, you can talk a little bit more about, which are really trying to bring in some of key messaging and top level key messaging around violence and care. And the idea for that is to have some kind of common messaging that we can bring to the national, to the regional preparatory session ahead as people are starting to talk about these issues. And then I'm going to talk about the thematic brief, but Caroline, maybe handing over to you on the key messaging.
Yeah, thanks, Florence. I mean, that's essentially that is it in a nutshell. Yeah, we're working on, we're trying to keep it short, just like some top line key messages on what Florence was talking about, the links between violence and care. That will hopefully be useful for the national preparatory sessions, and some suggestions. Obviously, the commitments are going to differ hugely from country to country, depending on what laws already exist, what frameworks already exist, and things like that. So we're not going to be too prescriptive, but we're trying to put down some ideas as well, and then also some overall framing. And the other thing that's going to be in that document is a little bit of information on some kind of guidance on how to engage with the process for organisations that have already started engaging with the process. And some, and we know some about countries that Lumos works in, know that things are happening already next week, but it's just initial meetings. So I think like some of these processes, it's not just one day, obviously it's taking time in the country. So there is still opportunity for organisations that haven't even started being involved yet to try and get involved. So that's what we're trying to also give a few indications of how to get a kind of hook into the process to start collaborating with the government on it. Yeah, and also, although this is less developed in this briefing, child and youth participation in the national preparatory sessions will be really important. It's important across the conference as a whole, but there's going to be a lot less scope at the global level. And so it really is much, much, much more important at the national level. And Barty from Save the Children has worked on a briefing around child participation in, not just children, also survivors, people with lived experience. And there's another booklet that's been produced by the overall organisers by Barty about that. So that's useful as well. It's mostly targeted at governments, but it's also useful again as a starting point to try. And that's another point that we really want to push, to try and make sure that children with care experience are included in all of those consultations. I think that's everything to add. We'll be trying to be able to share that in the next couple of weeks.
Thank you. Chris, please come in.
Hey folks, really quick question and comment here. So this is quite an important topic, subject area for me. I was telling Florence the other day, just because of how many times I've been shut down and asked to leave a room when we try and connect violence against children with the work we do. I'm so glad to hear about these booklets, Caroline. I wonder, folks, if there is anyone who has or could, I'm happy to work with anyone, record a short video that we can share, particularly with the care experience community, some of our practitioners working in, some of our colleague partner practitioners working in institutions that we're trying to help with the mind shift, just to highlight the importance of this conference that's coming up and how we want this work to continue. The reason I emphasize short video is a lot of text is going unread and we're missing a trick. And it's just a short video. Hey, how you doing? Have you heard about this conference? It's coming up. And it could be lots of our different voices. It could be a little script that we all record. We just need to get the word out. We need to go viral in this. So just thought I should throw that in.
That's a great idea, Chris. And definitely happy to work on this. And Amanda and ourselves at the discussion, Amanda raised that very point of how do we ensure that we use creative approaches to reach a whole range of audience and also to enable the participation of a range of actors. I don't know, Amanda, whether you want to add anything on the discussion.
No, it's a similar idea, but to look at to what extent we already have pre-existing material from children, young people, and those with lived experience using different methodologies. So whether that's and often through a therapeutic lens. So it's sort of whether art therapy or digital storytelling or photo voice or whatever we've got pre-existing that we could use, whereby children and those with lived experience are already making the connection between their experiences and how violence is part of that. So that's what we were hoping to do, and then be able to weave that through the side event by being able to say, not just that's the issues that are being raised, but this is how practitioners are starting to use creative methodologies in a trauma-aware, if not a trauma-informed way, to work on issues around violence in different locations. So we thought that might just bring a different feel to the thing, which might then alert more attention. So
definitely. So, Chris, yes, happy to work on this. The Care Leaders Council, I'm sure, will be delighted to work on some videos. Others, I'm sure, will be. As been mentioned before, there is involvement, although always limited, but it's really important to have involvement at the national level. But there is involvement of actors, of care experience actors and networks at different levels, both at the conference in our working group in the planning level, are going to be heading the table at the satellite event and so on, but what are the other ways we can actually bring these actors and their recommendation at the table is really critical. And this leads to the other thing I was going to mention, and that's the boring document, I'm afraid. We are going to be working on developing a brief, a policy brief, a thematic brief around violence and care for the conference, and going to be working with a consultant and with all of you to develop that. The aim of it is really targeted at policymakers, and it's to condense and the evidence, but also the argument for that intersectionality and around both, but also the evidence around practice. And that is going to be one of our biggest challenges. So I appreciate Florence sharing some evidence. We are going to need to show what works. What do we know works in terms of addressing the violence that these children are facing? Both, again, as a driver of separation, placement in alternative care, but also in alternative care. And we're very good at talking about the issues. We have a relatively good amount of evidence around those links, clearly. But we actually don't have, I think we lack, and I might be wrong, and I'm going to be delighted if I'm wrong, but we lack really enough documentation of good practices around that. And so one of the things that the thematic brief will do as well is to highlight specific instances, like I mentioned in the webinar, Hagar's work in Cambodia that provide foster care, specific foster care for children that have faced sexual abuse and trafficking. That is a really critical aspect of practice that the violence sector needs to be aware of and needs to integrate into their practice as well when it is good practice. What are the other aspects of good practice do we have? Do we have good practice in terms of preventing violence in residential care? We know how difficult that is, and we know of some experience, but do we have documented practice of this actually having an impact on the violence that children face in residence? I'm using this as an example. There are many others. So part of the thematic brief will be about summarizing the evidence and updating the evidence that we have. It's going to be about articulating some of the key interventions, some of the key asks, because we want this to influence what comes out of the pledges and more importantly, what gets discussed in the follow-up to the conference in terms of implementation, and the implementation not just of the care reform actors, but of the violence actors as well that are working around that broader agenda. We want country example, we want local example, we want practice example that we can point to and highlight as good practice. To also integrate as part of the evidence strategies that are under Inspire. So asking you as well to be thinking of the work that you do, the work your partners do, the work that you think would be really helpful to highlight as part of this process and as part of the thematic brief. So there'll be opportunities to feed back into the brief, to provide example, good practices, and contribute to the recommendations over the next couple of months. So I wanted you to know that. Have I missed something really key? Becky, Caroline, in terms of what's happening in the violence and care? I'm sure I have, but these are some of the elements of what's happening. So the satellite event, the key messaging, the, of course, involvement in national, regional preparatory session, the thematic brief that's going to help us kind of clarify our agenda and our evidence. I think that's about, and the work with the care experience actors to ensure that their recommendation and their advocacy is right at the table. I work with our disability rights colleague who are part of this group as well, and ensuring that this is a key part of the agenda as well. So I think that's about it for the VAC and for the Bogota conference. But please let us know. Yeah, Amanda, please.
Sorry, Florence. Picking up on what the other Florence just said about Indigenous communities also being those that particularly, should we also be ensuring or aiming to bring in some of them to this as well as the disability group? Okay.
Absolutely. Yeah.
Okay. We'll look at who we know to try and bring that through.
Yeah. And I will say one of the thing that I expect that this is going to be a big issue for the Latin American colleagues, as it is a big issue in many regions. It is a big issue in that region, but it'd be great as well to to make sure that discuss with them and make sure that that is. All of this to say, as well, a lot of this work is being done on a shoestring. There isn't a gigantic pot of money for anything, so we're all kind of cobbling up our efforts, our energy, pulling together, you know, our resources to leverage our influence on this. But unfortunately, like a lot of this thing, there's as we all know, the sector is facing a lot of funding challenges, and this isn't clearly on the agenda either of a lot of the funders, although it's on the agenda. And the violence sector is also facing funding issues. I should say, not just the care sector, it's child protection across the board that's facing. So, but we are, so all of your thinking, learning, input, you know, is really needed and very welcome. Again, if you want to be part of the discussion on the VAC and care group, just reach out and we'll add you to those. So thank you. Handing over back to you, Caroline.
Yeah. Just speaking to that point, I know World Child Foundation, you've got engaged in this. Is Elevate Funders Group, are they sort of being brought in?
They are brought in terms of some of the work around violence and the actors. So I know they're part of some of the discussion. As you know, many of the Elevate funders have also narrowed their focus on this. So I know as far as child abuse is concerned, definitely Oak and some of the other actors are involved. But I think it's limited to that.
Okay.
From what I understand.
You know, it's a way of reawakening awareness within the donor community.
Absolutely, yeah. And also emphasizing that this is a critical issue that's not going away, that child protection is clearly you know, a major issue for not just for billions of children, but for a lot of actors that are trying to strengthen system, whether across different types of systems, so not just the child protection system. You cannot be strengthening the education system unless you address child protection, et cetera, et cetera. So as we try to emphasize, you know, to Becky's point, we've been talking about child protection system for a long time. As we try to emphasize a system approach, the donor seems to have shrunk back to a siloed approach of, you know, oh, we do child abuse, but we don't do child protection, or we do, you know, and so our challenge is, or we do climate change, but we're not going to be doing child protection, you know, like you're like, so this is it is a major opportunity for us as a community to make those points, to say like, look, what you're doing has implications for the critical work that's happening across systems. So I agree, Amanda, it's a very important. There is a pledge, just to add, the donors are expected to also make a pledge of funding on this agenda at the conference. So there is definitely a donor component of it. We don't know much of the details as to how they're putting this together, but there is definitely a donor pledge around the follow-up. Again, quite focused, my understanding, which is limited, but it seems to be quite focused around this pathfinding countries 2.0. So like supporting the implementation of the work at the country level. And yes, Becky, the US government election, exactly, that are happening at the same time of the conference, which is a very good way of an excuse not to be in the country. If you happen to be living like me in the country. Anyway, thank you so much, Caroline.
Thanks, Florence. I'm sorry to cut in, but I'm conscious that Marie has to leave on the hour. So if we have any other discussion on this, we can pick this up towards the end of the meeting, if that's okay with everybody. So in that case, I'll pass over to Marie to talk about the Summit of the Future.
Thank you very much. And yeah, apologies, guys. I have to leave in just about 15 minutes, and there are a number of things that I'd really love to talk you through about the Summit of the Future and the sort of the wider SDGs process. But also, of course, feel free to reach out via email if there's questions. Well, after I have to leave you. Yeah, so a quick update / background / joint thinking, hopefully, around the upcoming Summit of the Future and the wider SDGs milestones. So due to competing priorities in the past few years, we're only really at Open Homes level starting to work on it since the past let's say, 8 months. So a lot of it is capacity building and work in progress. Do bear with me, please. But I'm really, really happy to let you know where we are now and to start thinking about what we can do as a platform, as a collaborative, and as a sector, really, to link the care reform movement with the conversation about sustainable development. In this current framework, the 2030 agenda, but also more importantly, maybe, and more strategically beyond that. I'll explain a little bit about that in a moment. Just to say that it is a long-term conversation. We're starting with, as a starting point, with the Summit of the Future, but the Summit of Future is one event in a really, really long string. So that's what I'm going to try and show in the next couple of slides. And I'm saying this because I wouldn't want us to put all of our baskets and all of our very strong capacity in that one event without realizing that we're going to have to, I think, be fairly conservative of our energy as a sector and to make this be a long-term advocacy strategy rather than sort of short-term and around that one event or the next one. All this to say, yeah, a little bit of background around the summit and where it comes from. We're about halfway through the SDGs framework, the 2030 agenda, and there's a stark realization that we're nowhere near states or nowhere near where they should be when it comes to the targets. And the goals that has led to a number of high-level initiatives, one of them being the UN Secretary General big publication a couple of years ago called Our Common Agenda, where the Secretary General made a number of proposals to really speed up progress. That has also been touched upon in the last SDG summit that took place last September 2023, that also called for acceleration of progress and stronger commitments around the realization of the 2030 agenda. Both of these events are really sort of the inception of the big Summit of the Future that takes place 22nd, 23rd of September this year. That happens in the last few days of the UN General Assembly, and that takes place in New York. The summit is a big intergovernmental conference. I think that's really a key point. I'll mention the need for really engaging with government, states, and sort of regional political alliances between states to really try and move forward the agenda, because that's something that in our few months working very intensely on this, we've realized we really can't get anywhere without the support of some states. And just one thing, the summit is meant to launch some big policy documents, including what is called the Pact for the Future. So I'm sure some of you will have heard about that. That is meant to really be the sort of a renewed commitment to the SDGs with a set of actions on how to move forward. And just to really show that this is a whole approach and the whole process, I just wanted to highlight this graph that I shamelessly stole from another NGO group that I've been sitting on, that really shows this timeline of 3 big milestones around the SDGs, the Education Summit that took place earlier this year, the Summit of the Future, and the World Social Summit that will take place in 2025. And around these 3 big events, there's going to be a number of these high-level policy documents that will be discussed, strategies that will be discussed and adopted. Around all of these that you see in this slide, there's really not many that I think are going to be our main focus, but just to say it's a whole conversation, and I think it's also smart for us to be aware of when we try to engage with states, that there is a lot going on, and that the summit is one opportunity. There have been some before, and there are going to be many more. I just wanted to share a little bit on the actual SDGs before moving on to the summit. The SDGs are, so as you know, are 17 goals, a lot of them around human development, no poverty, reduced inequality, equality education, and all that. And to sort of monitor progress on the SDGs by 2030, there have been a number of indicators that I can't remember the exact number, but I think it is in the hundreds. I'll share around, maybe there's an excellent brief from UNICEF that has screened all of them, and that highlights that there's about 35 indicators that really focus on children. And among these indicators, it's really interesting, you'll see a lot of them that go in the right direction, monitoring the number of children in forced labor, in child marriages. But I find that what's missing in the current SDGs and in the current framework for us, for our movement, is really the circumstances, the places, the places in which harm and violence occurs to children. So there's going to be a number of them, again, child labor, child marriages, but for instance, there's nothing on child institutionalization, there is nothing on children in the streets, street-connected children. There is nothing on children in migration or refugees and asylum seekers, and we know that a lot of them end up becoming unaccompanied and separated. So I think there's a wider conversation to have around how there's some huge gaps around children who become deprived of family care. Child institutionalization being for us a huge question, but I sense that down the line as a sector, we're gonna also want to discuss the wider conversation, because I think it's such a gaping a gap, such a huge gap. And to me, that's our hook. It's showing states and UN bodies that they have missed the ball on this. That there have been a couple of occasions in the past, but I've seen that now. We couldn't take them up at the time, where the indicators were being renegotiated, but just to say, to renegotiate, to add new indicators in the framework of the SDGs, you have to come with a lot of things that our sector crucially misses, data being the chief amongst them. So I just want to flag that when I was saying that strategically we'll have to already think of the post-2030 agenda, I can see that that's some very key elements that we want to think about. How do we bring about the conversation around children deprived of family care in the wider protection question around children in the sustainable development agenda post-2030, whichever form it may take. Sorry, back to our Summit of the Future again. That's one event, but that is quite momentous in the SDGs conversation. Take place 22nd, 23rd of September. Very, very high level, 2 super packed days. There's going to be 2 action days just before 20th and 21st, sorry. Where NGOs will be able to organize some side events. I think there's a few days left to register for them. Hope and Homes has decided not to organize in-person side events for a number of questions, one of them being capacity, but I'll go back to our plans in a minute. There's a number of impact coalitions, emphasis on the pact, around the Pact of the Future. So impact coalitions that have been launched a few months ago. They're stakeholders, interest groups, led often by civil society organizations around some key topics. There's one, for instance, on children's rights and participation. I think it's being coordinated by World Vision. There's not been too much traction so far on it. I think they're still sort of figuring out how to work on this big coalition. There's a lot of organizations that have signed up. Hope and Homes has. If you're interested, please drop me an email and I'll let you know how to join the impact coalition that you're interested in. But so far, quite frankly, I don't feel like this is going to be the silver bullet to get some traction around children's rights, because it seems like it's such a huge coalition with not much, how do I say, not much direction yet, at the very least. And there's going to be a follow-up, the Summit of the Future, with commitments to review the progress at the next GA session from impact for the future. And just the right side of this slide, a few words on the outcomes of the summit. There's the Pact for the Future that has been drafted by Germany and Namibia, the Declaration of Future Generations by Sweden and Jamaica, and the Digital Compact, which I don't think is any of too much interest for us yet. We have tried to input on the first two documents rather, quite frankly, unsuccessfully when it comes to introducing questions around child protection and care specifically. We have worked with wider coalitions, colleagues in Child Rights Connect, for instance, to try and get some good wording around children as a whole with medium success, but that will be because both of these policy outcomes are incredibly top line and that there's a number of very contentious issues in both of them. We leave with these three slides, these three images that are really what Hope and Homes has identified so far as what we can share as key demands on how to include child protection and care reform as a key point, a key enabler of sustainable development. The main two will be the images in black, which are very, very top line demands. We're trying to be as top line as we can be, as attractive to non-practitioner audiences. A lot of the states that we're trying to influence aren't very well versed in our sector. So we're trying to be very, have those salient points, but at the same time not be too technical about it and really have some hard-hitting key demands. I will be very happy to share those on our platform, online platform in a little bit. These are still draft. These are still draft, and we're very open to discussing as a sector what needs to be fine-tuned there. I think going back to Becky's point about sometimes having to not make thesis either, we really want to remain with a key, very, very clear bullet points. But yeah, that's what we have so far. And that's the basis of what will be our advocacy campaign around the Summit of the Future. So starting from early September, and very, very comms-based. And again, all this is under preparation, but we're really keen to have every and all member of the Global Collaborative Platform input, and also hopefully join us, endorse, and disseminate widely. We'll have to go in short minutes, so I'm really, really sorry. I'll try and make sure next time to be able to stay for the full time, but I'm going to share the summary of all this online on the platform. I'm really, really keen to have a chat via email if we want to have a quick follow-up call. I refer to the co-chairs on this, and there's going to be a lot of work around that. There's going to be a lot of noise around that as well. And I just want to say we want to be very strategic, not to run after every opportunity for the sake of it, and again try and really be smart with how we do what we do, because it's very easy to just drown in the sea of initiatives around the summit, around the World Social Summit in a year, around the SDGs as a whole. Back to you, Caroline, and I will stay for one more minute and then wrap up.
Thanks very much, Marie. How long can you stay? I don't know if you
10 more seconds. I'm chairing my next call. I'm really sorry.
Chairing it. Okay. Okay. So I'm sorry. Sorry that I have opportunity to ask and answer questions about this, but yeah, it'll be great to.
Please, any questions? If you continue the conversation now, any questions that come my way, just drop me an email and I'll be very happy to answer. Thank you so much, guys.
Maybe, Mary, just to say, put the question in the global platform so that you don't have to answer the question with everybody. So I would say not just do it by email, make sure, because otherwise you're going to get 25 same questions.
That's great. I'll send a post tomorrow and then everybody can comment. Great day, everybody.
Thank you.
I don't know whether we want to do any initial reflections on that because Marie's had to go, but any initial thoughts, or should we just wait and see what questions
I mean, I think that she's opened the floor for any feedback on the language around messaging. So I think if we have, recommendation, I think it is important to align around messaging to the extent that we can. So I think it'd be good for us to provide feedback on that for sure. That's my main takeaway. There's a lot of information. I think we all know this is a massive process. Our ability to influence is limited, but I think the point is maybe beyond this initial phase, what can be done. And I think some of us remember from having been involved, I'm looking at Amanda, in the SDG process, we also have learned that lesson.
Yeah, exactly. You can feel the pain when they're, oh no, please not.
Yeah.
Sounds like everybody's leaving, so I'm conscious.
Yeah, Becky,
Yeah.
I know you need to leave now, so
Thanks, Becky.
Yeah,
sorry. And also just to say, I know Save the Children is involved quite a lot in these HLPF discussions, but even internally, it is really difficult to get any space for child protection at all, much less care. So yeah, I just think we need to think through what's the most strategic use of our time and what small thing we really want to push for. But I know just from our own internal battles, it is not an easy space to get visibility.
Yeah.
Thanks, Becky.
Thanks, Becky.
And Chris, you want to come in on anything at all from today? I know you said you've got to go soon.
Yeah, no, look, I wanted to, Becky made the point I was going to make. I had my hand up just then. I was going to say that, look, we have to recognize that we can do very little in such long, there's so much effort that goes into this. You heard Marie talk about capacity. That's the same thing all our organizations are going to say. So I think we need to be strategic, and also we need to be coordinated with all the agendas that we're leading on. So, we've got this VAC agenda, there's SDGs. I think we need a space we can sit in and go, right, folks, how do we make sure that there's some sort of coordinated thing where people recognize that this is happening from this sector? They're saying something, because like we've pointed out, like Becky pointed out, I had a long conversation, and I was in a couple of conferences where we were pushing for child protection and care around the SDGs to be properly highlighted. And then the fact that even with climate change, people miss the point. So I just wanted to highlight that. So I hope I haven't repeated the point. But then also, if it's okay, I just wanted to quickly say that from the sort of our regional point of view, so this is, Africa and the work we're doing there, there's been quite a bit of progress. And, I know we've moved away from updates, but I just wanted to share here, and it's good to see you, Caroline, that, there's a small group that worked on a theory of change, which I'm really keen to share with this group and get a lot of your feedback from. So Caroline, I think this would be a great group. You seeing you on the call reminded me to ask for that. So we'll share that. The theory of change is purposefully created to support the Africa Advocacy Initiative, so that we can really bring the African Union on this journey with us as early on as possible. So one of the things we're doing is we've been involved with asking the African Committee of Experts on the Rights and the Welfare of the Child to develop a general comment. They've approved that. But folks, again, I'm going to need all your advocacy, influence, amazingness to ensure that we have a general comment that is representative, and that in 10 years, we haven't left a legacy for people to have these meetings to try and add or change or chop things. So I'm really just calling on colleagues that, we're going to need your help. I'm going to need your help. Stephen, Grace, and the entire working group is going to need your help for the general comment. The TR went out. It was till last Friday. It was up for about 4 weeks. I'm really sorry if this group didn't see it. This is something I was trying to get out, but I was away for a while.
It was posted,
thank
Chris.
goodness. Thank goodness.
It was posted across. Yeah.
And I hope folks, any of your colleagues or partners have applied to that, but we don't know much. So I'm going to find out next week, what's happening with that, what consultants are being shortlisted. I will share that with Florence and the BCN crew. Hi, Margot, and make sure that that's shared with all of you. then the other bit that's happening is towards the end of this month, there'll be a learning mission with the African Committee of Experts Rapporteur for Children Without Parental Care and Education. We'd hoped it would be the Rapporteur for Violence Against Children, but they're not available. So we're going with Education and Children Without Parental Care. They're going to Rwanda and Kenya. I won't go into the detail. On the point of violence against children, we're still keen to link and connect the rapporteur at the African Committee. So again, I'll reach out to Caroline Florence to see how we can have a side conversation and ensure that happens. Otherwise, the meetings are happening regularly for the African Working Group Children Without Parental Care. We invite as many of you to join and be supportive. And Amanda, it was good to see you there on one of the calls. And of course, our biggest gap is Northern Africa. A big struggle, and then the other gap is translation. And I won't even go into this, but you know, Florence, I forgot to pick your brain on how we can do translation for our calls, but also ensure that it's into the emails and everything else. So, folks, I hope that gives you a bit of an update on what's happening in the region. We need your help. We need your continued support. And for some of you, I just want to say thank you.
Thanks very much, Chris. That was really, really useful to have that update. And also, I just wanted to quickly ask, do you have an idea of the timeline for the general comment yet? Or is that what you're saying you're going to update us on when you hear more?
Yeah. Let me find out what's happening and then I'll update you. I mean, we have a fund from UBS. UBS gave us some money for the initiative to fund the general comment, but sadly we're being pushed to the side. So I want to find out what's going on, but we're ready to pay for it. And when I say we, the coalition, the consortium of the organizations, Open Homes, Lumos, Child's Eye Foundation, and a few others, Family for Every Child, we're all keen to see that the general comment is developed with this funding.
Great, thank you. Florence, sorry.
No, I was just going to say, I mean, to your point, Chris, this is precisely why we have a global policy and advocacy working group meeting and space, and why some of the actors may think, why are we here? It takes a lot of time or whatever, but it is about that, connecting the dots, identifying where the priorities, which we may not have as global actors, but other actors at the national level have ideas of what the priority, the messaging needs to be. So we need to, we need to be able as a community to have this kind of exchange, then determine strategically what are the areas where we might want to work together, what are the areas where one actor, I mean, Open Home is clearly very invested into the Summit of the Future, and it's fantastic. And being able to come here and let us know what are the opportunities to contribute or to align. And I think this is why, as a community, we've got to continue doing this and find, strategic way. An example of this is, the general comment, Honorable Musiwa. She's going to be one of the speakers at the satellite event in Bogota. So that's about that. It's about making sure that we've got our cross alignment and we're able to influence processes so that she takes this initiative and this strategic leadership and then can feed that back into her role at the African Union, at the African Committee of Experts, and in the general comment. So the more we can do this, the better we are going to be, the more impactful we're going to be as a community, and the more knowledgeable of what each others are doing and seeing and learning. So yeah, thank you, Chris. This is all really, really important. We do want to do updates, and the only reason we didn't do updates as before was just that we felt that there was, we ended up doing updates after updates and we didn't have enough space for discussion. So it's that delicate balance. And we will ask your help to be thinking about how do we bring in at times, doing a quarterly meeting doesn't give much time for like, updates and. So maybe it's a question of alternating. I don't know. We need your help, but we wanted to deep dive on these big opportunities that are happening right now. One thing I did want to flag, and because I'm really thrilled, of course, one of the competing things happening this morning was the launch of the US government APCA revised strategy, which is a fantastic opportunity. I have to say I'm thrilled to say that Grace and Jerry from Kenya, who is one of the coordinators of the Care Leaders Council, spoke to it. And I think, again, having care experience actors being at the table in the thinking, the strategic, and in the profile is really important. So real congratulations to Grace on the presentation there.
That's lovely. Thanks, Florence. So we did have one more agenda item that we wanted to pick up on before I go to discussion about any of the points, which won't take long because we don't really have a lot to present on it, but just to flag about the care and support agenda, which, so there's the OHCHR is currently in the stage of preparing, is it preparing a report, Florence? Sorry, I feel like.
There's an expert consultation.
Yeah.
That is going to take place in the fall, which is in a response to a resolution of the council. Yes. So yes, they're going to be they are going to be preparing a report from the expert consultation.
So care and support, it's really, really broad, and it's about like basically everyone who provides care. So a lot is looking about obviously women providing the bulk of care around the world. They've talked also about grandparents as well, and then kind of a huge spectrum, but they haven't looked a lot about alternative care, except kinship care, except grandparent care. And so there's that we're now looking at how to. Well, one thing in particular that they really hadn't done was looked at consultation with children, or found a way to successfully do consultation with children, particularly children with care experience. So some partner organisations, including Open Homes for Children, although Manny isn't able to be here today, are looking at trying over the summer to do some way of consulting with children to feed into this, so that there's not nothing. And that what they're looking at is doing some small regional consultations. I think they're looking at kind of online sessions in specific areas, and it's going to be, because of resources and like limited time, it's going to be working, organizations who are able to contribute with children and young people that they already work with, kind of trying to contribute to this, so that there is some input from children and young people rather than there not being any. I don't have a great amount of detail about this, and I don't think any of them are scheduled yet. But what we've asked, because Manny wasn't able to attend today, I think he's going to do a little written update about it, and we'll post it in the group. And then if anyone's able to get involved in the different regions, I'm sure that will be very welcome, because obviously bringing in a greater plurality of voices with lived experiences would be great. And that's really the main thing to say there, I think. I don't know, Florence, if you have anything else that we should share.
No, that's it, except maybe just to say that is one, I'm just checking with Margot whether she can share the whiteboard from our last meeting, because it's one of these many different opportunities that had been ongoing and so on. It's one that I think, to be perfectly honest, as a community, we missed. And partly that's, again, this question of we're all busy doing so many things. It's very Geneva based initially, but it is an important opportunity, and we're looking at ways in which some voices around the care, in addition to Open Home, can be involved in the expert. I don't even know actually whether Open Home is part of the expert consultation, but we are definitely talking about who can be part of the expert consultation. It's already pretty much decided in one way or the other, so that we can influence this discussion, but recognizing that we're all very limited in terms of but that's exactly the kind of thing that I think, among all the different things that are happening in Geneva, in New York, and so on, we should have had on our radar a year before. And that's why these meetings of these global groups are really important, but that's also why the contribution of actors flagging things ahead. If you're sitting in Geneva, you're seeing this is coming, if you're sitting in Addis and you're seeing something coming, put it in and say, guys, this is coming. Doesn't mean that you're going to necessarily work, or that other actors will have the bandwidth, but it just enables us to be ahead of the curve rather than always responding to things after the fact. And I think it's critical. I'm really delighted that Open Home is looking at doing child consultation within the summer, but it's also really late, like how to bring. So I think just finding ways of as a community to stay ahead of the curve, to share information, to know what's coming, and then make the decision. When we talk about this thing, we might say, well, I mean, as with the Summit of the Future, don't have the bandwidth, not necessarily the most strategic, that's absolutely fine. But just being clear that we are aware of it, each other, of how we can use these different opportunities, through the leadership of one agency or through the collaboration. So I'm going to also add here, this is a spreadsheet that we use for the violence working group that we updated. It just has some of the activities. Let me know if you can't access it, if you're not already registered, but just to say, if you're interested in finding out some of the more about what's happening in terms of the Bogota conference, in particular discussion around back and care, but also more broadly, we update that sheet with information around countries and around, and if you are involved in a national or regional preparatory, there is a tab out of that basically says, if let's say you're sitting in Uganda, I know Chris has to run, but I was talking to him about, participating in that national process. Just put in national process, Child's Eye is, Family for Every Child is, Lumos is, just so that we know and we don't think, oh God, there's, no one doing it. No, there are. And so we can make sure as well that we know what's happening. So thank you. Over to you, Caroline.
Great, thanks, Florence. Yeah, that's really important. Thanks for raising that. So, we have a few minutes left. We have an option of AOB if anyone has any AOB, or any further discussion or questions relating to anything that we've already discussed today. Doesn't seem so. Okay, so I think Marie obviously is going to post something in the group, and we'll see her questions on. So I think she has questions for us, I think, as well. And then, yes, like you said, Florence, she's going to share some of that wording for comment. There was the feedback to Becky on the child protection system strengthening as well by the end of next week, with any kind of major points. And I can't remember if there are any other actions. I know Chris is putting his own actions in the comment box, so that's perfect. I don't think there were any other major actions, but okay. I think
maybe just one tiny update. The Care Leaders Council is in the process of recruiting 11 new members. So these are care experience advocates. It's got an amazing response, overwhelming response, over 150 from all over the world. And it's really, I just wanted to say, it's really exciting to see both the interest, the expertise of care, care experience advocates, and of course it's very difficult to choose 11 out of this incredible group of actors. But I think one of the ways the Care Leaders Council wants to do is to actually go back to all of those and find ways of involving, whether they get selected or not, but this very large community of actors who are care experience and advocating at different levels in their country or regionally and so on. So just to say, it's very exciting, including representation of, to your point, Amanda and Florence, the groups of actors. That's been a strategy of it. Groups of actors that are, overrepresented in the system, that are part of, whether they come from disability, because of disability, or because of they're coming from a minority, or because they are from the LGBTQI A+ community, and so on. So it's exciting. 11 members is not enough to represent all of these, but just to say, there's a lot of exciting stuff going on. And I know the Care Leaders Council, once the new members are in board, it's going to be 16 members altogether, are going to be really keen to engage with you and to all of the members of this community. They've taken quite a long time, understandably, to transition to their own body and format and so on, but they are going to, once the new members are appointed, reaching out, and some of them are already in touch with you, but I would encourage you to interact with them and identify, ways to engage with them. So just to say that, as we had time. Sorry.
great, thanks, Florence. And it will be really great, yeah, to have them more involved in. Okay, in that case, I think we can wrap up 10 minutes early.
Brilliant. Thanks, guys.
Thank you.
Thanks, everyone.
See you soon.
Thank you. Bye.
Bye.
Caroline, do you have 2 minutes?